So now it's my great honor to introduce my friend, collaborator, and colleague, Erin Mordecai. Erin's an associate professor of biology here and senior fellow in the Woods Institute for the Environment. She's also a faculty fellow in CIGH. And today she's going to talk to us about massive global impacts of climate change on dengue transmission.
Thank you so much for the invitation to speak today. I'm excited to share some of these results with you. This work was done in collaboration with Marissa Childs, Kelsey Leiberger, Mallory Harris, and Marshall Burke here at Stanford. And what we're going to show is that there are massive impacts of global climate change on dengue burden that have happened already and that are continuing to happen into the future. I want to take a moment to acknowledge the funders of these studies, including NSF, NIH, many of the Stanford Institutes and Centers, including CIGH. And if you're interested in reading more of the details and methods that I won't have time to get into, I welcome you to check out our preprint on medRxiv. I'll give you a second if you want to scan the QR code. Okay, so dengue is a viral disease that typically causes fever and can cause severe joint pain and even more severe disease, hospitalization, and death. And it's a mosquito-transmitted disease transmitted by two primary vector species, Aedes aegypti, or the yellow fever mosquito, and Aedes albopictus, or the Asian tiger mosquito. The disease is really widely spread throughout, particularly the tropics and subtropics of the globe, but we're starting to see it expanding into more temperate regions as well. It's estimated to cause between 60 and 100 million symptomatic cases every year, and about 4 times as many total infections, because a lot of infections are asymptomatic. Now, on top of the existing global burden of dengue, we're starting to see increasingly intense dengue epidemics year after year. And in fact, 2023 and 2024 were 2 of the worst dengue years on record. 2023 was the worst on record, and then it was doubled and surpassed by 2024. Now, one of the potential players in this expansion of global dengue risk is the impact that humans are having on the planet, and in particular, anthropogenic climate change and climate warming. So the question I wanted to address in this research is climate warming driving these increases in dengue burden that we're seeing globally? Now, we can begin to think about this question by breaking down the mosquito life cycle and the mosquito transmission cycle, which is essential for the transmission of dengue virus. First, you have mosquitoes. The females lay their eggs in bodies of water. Those eggs then hatch. They go through 4 larval developmental stages. They pupate and emerge as adults. And the rates at which these mosquitoes survive, reproduce, and develop depend on temperature, because these are cold-blooded insects. In turn, the part of the mosquito life cycle that they're most famous for is that the females take blood meals from vertebrate hosts, and the rate at which they're able to digest those blood meals and turn them into eggs is also dependent on environmental temperature. Then the virus, for its part, has kind of hijacked this mosquito life cycle, so that if in fact, that blood meal contains virus, then the mosquito can become infected and have a disseminated infection with dengue, and eventually inject dengue virus into the next host that it bites. And this extrinsic incubation process and the probability that the mosquito becomes infectious is also dependent on temperature. So looking across this whole cycle, we can imagine lots of different ways in which temperature, and therefore climate warming, might affect dengue transmission. And in fact, we can go even further than that, and we can experimentally modify temperature in the lab and hold mosquitoes at different temperatures and measure every aspect of their transmission cycle. And when we do this, we can develop a model of how dengue transmission is likely to respond to temperature. And here's a model in which we did this, where we're modeling temperature in Celsius on the x-axis, and on the y-axis, a relative measure of transmission potential, or R0. We estimate that for dengue virus in Aedes aegypti, transmission peaks at 29 degrees Celsius, and for Aedes albopictus, it peaks at 26 degrees Celsius. You can see in both cases there are really strong impacts of temperature, but they're nonlinear. So there's a peak, and there's an ascending slope and a descending slope with temperature. So this is kind of where we started this study, with this a priori expectation based on thermal biology that there would be strong and nonlinear impacts of temperature on dengue transmission. But the gap here is we don't know quantitatively, going from the lab into the complex real world, how much is temperature driving patterns of dengue transmission, and how many cases, or how much of the incidence is actually caused by changes in temperature. And a corollary of that is how have historical warming that have already happened and future warming that's going to happen because of anthropogenic forcing, how much has that impacted the global dengue burden? So we set out to answer these 2 questions using a causal approach borrowed from applied econometrics. And this is where these 3 fantastic students and postdocs came in. They really spearheaded this work. The idea here is that we're using climate variation as sort of a natural experiment. So in this econometric panel regression approach, we're leveraging quasi-random variation in the climate by comparing many different spatial units, such as districts or municipalities or states, to themselves over time, while also controlling for other potentially confounding variables. And the idea here is that we're testing a specific hypothesized causal effect. So we're not just looking for anything that explains dengue, we're asking how is temperature in particular affecting dengue incidence. To do this, we assembled a 21-country dengue data set, and in each of these countries we had sub-country level dengue incidence data going back many years, on average 11 years, but some of them went back as far as 30 years. You can see in the different colors, these are the countries that were included in the data set. They vary in both temperature, in the sort of red axis, as well as their dengue burden in the blue axis. And you can see, just kind of aggregating across several of the countries in the data set, that there's a lot of variation in these time series. But many of these countries have these kind of annual epidemic cycles that vary in size from year to year. So our econometric approach starts out by asking how dengue incidence is a function of temperature, using these over 7,000 different spatial units from 21 different countries, matching them with de-biased and downscale ERI5 temperature data from the time when the dengue cases were reported. We're also controlling for precipitation because we expect that to affect dengue transmission. We're including fixed effects for administrative unit, country year, and country month, which controls for some of the shared and potentially confounding variation. It might confound our estimate of the true relationship of temperature and dengue. And then we're performing a population-weighted Poisson regression. And I'm happy to address more of the details of the methods and the questions if you're interested. Now, our key result is that we find a nonlinear impact of temperature on dengue incidence. So this is the main estimate from our model, shown in black with the gray confidence interval. So we can see we're estimating a nonlinear effect of temperature on dengue incidence. And in the histogram, you see just the distribution of temperature values in our data set. And the vertical lines are the country level averages. So you can see that most of the countries in this data set are on the ascending part of this slope, ranging from Bolivia at the coolest up to Cambodia at the warmest. If we compare this with our a priori predictions, we can see a few things that really align nicely. One is that we predicted that dengue transmission would peak between 26 and 29 degrees Celsius. And we see that, in fact, our empirical estimate from case data is that it peaks around 27.8 degrees Celsius. We also find empirically that the steepest slope of dengue incidence with respect to temperature happens around 20 degrees Celsius. And that aligns with, in our R-naught model, where we see the curve accelerating most rapidly. So this suggests that we can really recover this, what we know from thermal biology, in global human case data, which is pretty interesting in and of itself. Now we can apply this model empirically to ask, in a counterfactual scenario where humans have not warmed the climate over the last 100 years, how many dengue cases would we have seen? And that allows us to estimate how many dengue cases are attributable to anthropogenic climate forcing. What we find is that climate warming has already dramatically expanded the burden of dengue. In particular, on average, 19% of the global dengue burden is attributable to climate warming, and this is from the period of 1995 to 2014, so not even including the most recent years. You can see that this effect is disproportionate in particular parts of the data set, in particular highland areas of Mexico, Colombia, Peru, as well as southern Brazil. These are places that are kind of cooler on average, where climate warming has had a greater impact. And there, up to 40% of the dengue burden is attributable to climate warming that has already happened. Now we can do the same thing, but ask, looking forward into future climate scenarios, how much additional change do we expect in dengue burden? And what we find is a dramatic across-the-board increase in dengue burden by about 61% on average under the sort of business-as-usual SSP 3-7.0 scenario. Again, you can see these effects are really disproportionate across the data set. In Southeast Asia, they tend to be lower because the temperatures are already warmer, whereas in most of Latin America, the effects are larger, particularly in some of these high elevation and southern parts of Latin America, where we also have very large population centers, indicated by the circles. We estimate that about 257 million people are currently living in places that are expected to more than double in dengue incidence. And that doesn't even account for the potential population growth happening between now and mid-century. So these are really dramatic predicted effects of future climate warming. Now, the one sort of smallish but important piece of good news that I have that emissions reductions will dramatically benefit health in terms of reducing potential dengue burden in the future. If we compare two climate scenarios, one that's sort of the best case and one that's a business as usual, things are about 18% better under the best case scenario on average. But if we look across countries, which is each of these different points, we can see that some countries are seeing 100% or more benefit from the climate mitigation scenario. Places like Bolivia, Peru, Mexico, and Colombia, which are the most highly impacted by climate warming already. And I want to note that this approach is conservative because it's accounting for lots of other potential confounding variation. There's also some really important data gaps, including all of Africa as well as India, where we didn't have access to suitable data to do this analysis. We're also not accounting for potential range expansions of dengue and its vectors, or changes in control measures or vector species composition. So, to summarize, what we found is that climate change is dramatically increasing the global burden of dengue. We see nonlinear impacts of temperature on dengue incidence, which are really consistent with what we know of the thermal biology of the mosquito. Warming has already expanded the dengue burden by about 19% on average, and in some cases 40% or more. Future warming, these effects do vary based on the baseline temperature, so places that are at more of the kind of cooler threshold are seeing the larger impacts of climate warming. Future warming is expected to increase dengue dramatically by mid-century, particularly if that warming is unmitigated. On average, a 61% increase in dengue burden, but that's more than doubling in many places of the world that are highly populated. And finally, it's very important to know that emissions reductions are critical for mitigating the impact of climate warming on dengue transmission. Thank you, and I'm happy to take any questions. I don't think the microphone's up there.
Okay. Okay, so perfect. You mentioned range expansions, and I just couldn't avoid to observe that Mexico is at the border with, the United States, and so did you already try to do some of those projections in southern United States that I think are relevant for the health of the people?
Yeah, definitely. I think one of the prime candidates for range expansion of dengue is the United States, particularly the southeast, places like Florida and Texas, but also we've seen some local dengue transition in California for the first time in the last couple of years. And the California Department of Public Health is particularly concerned about the potential for local transmission, given that we have the vectors established in California, they are expanding, and there's quite a few imported cases coming from travelers outside the region. So we wanted to be really conservative with this model and not project outside of the countries that we use to estimate the relationship. But because that relationship is so consistent with what we know of the thermal biology, I do think that it's likely that these same types of increases are likely to be important, and in fact even more important at the range edges of dengue. Places like Argentina and South America, as well as Europe and United States, particularly the southern parts, where we're really at those temperature thresholds, and warming is going to really drive us closer to that optimal temperature for transmission of dengue. Thank you.
Thank you. Really fascinating. Alberto from CDTRL here at Stanford. I was curious about two things. One is the quality of the epidemiological surveillance in each country. I mean, particularly the graph of Colombia and Mexico suggests they're quite different.
Yeah.
I trust more the Mexican data than the Colombian one, but that's my bias. And the second question is about the built environment. So could you figure out things about how the same temperature would be very different in rural versus urban setups because of the way dengue gets transmitted on puddles and all that kind of thing?
Yes, thank you for those questions. One really important thing to know about these types of analyses is that we're talking about relative changes, so changes in a given place relative to its baseline amount of dengue for this very reason, because we know that there's lots of underdiagnosis of dengue. I mean, we think that at least 3/4 of the infections are asymptomatic to start with. Of course, there's lots of variation in access to healthcare and diagnostics and so on. But one of the things that's important about this tool is that by comparing places to themselves, you're sort of controlling for that underlying variation in the likelihood that a given dengue infection gets detected. And that doesn't even necessarily have to be constant over time because we have country year fixed effects as well. So let's say, if economic recession hits a country in a given year and that impacts healthcare access, that effect would be sort of swallowed up into this fixed effect, which then makes the estimate of the effective temperature on dengue more robust. But if we're trying to calculate absolute numbers of cases, then I think this is So we were interested in whether there would be any modifiers of the temperature and dengue relationship, including the built environment, but also including socioeconomic conditions, healthcare expenditures, existing dengue burden. And so we tried everything we could think of and measure. Basically, we tried looking at, modeling this relationship for subsets of the units, for example, like high income versus low income, high healthcare expenditure versus low. And we didn't see any modifiers of the temperature-dengue relationship, except so Latin America, our sample was really dominated by Brazil, because it's a huge country with lots of municipalities. And so if we separate by Latin America and Southeast Asia, you get a slightly different inferred temperature relationship, but it's still, they're both nonlinear and they both kind of cross, they both sort of turn over like that. So it wasn't really a biologically meaningful relationship. But we didn't, it's really difficult to assess sort of local variation in built infrastructure and built environment in this type of analysis, but at the sort of course level that we were able to look at it, we didn't see any modifiers of the temperature-dengue relationship that we could find.